Hello, this is Dr. Emma from Aggie Vet and Farrier Services, and for this video, I would like to go over some general information regarding owning cattle. This information will be especially useful to new cattle owners, but even if you've owned cattle for years, it doesn't hurt to have a reminder. And this information applies to all breeds of cattle, from mini Highland cows up to Longhorns. So to start, I'd like to go over just some equipment that will not only make handling easier for you as owners, but for me as well, should I need to come out and treat your cattle. First and foremost, a squeeze chute or a head gate are an absolute must. Ideally, having both will provide the best form of restraint, but a head gate alone can be manageable depending on what we need to do. Head gates and chutes should be made of metal, as those made of wood tend to be more flimsy, and when restraining cattle, the more rigid restraints will actually cause less stress. If the cows feel as if they can kind of jostle around in the restraint, they will continue to try to break out. And that will not only be more stressful, but then you predispose to potential injuries of them trying to get out, of getting legs caught, and it becomes an issue of safety for you, for me, and for the cattle. So chutes are the safest way for owners and veterinarians to effectively treat and monitor cattle. And if there's inadequate restraint, then the examination and treatment process, like I said, is all the more stressful and difficult for both the patient and veterinarian. And if the chute is new to you, then make sure you know how to use it safely and effectively. When cattle are running up through the chute, the person that's working the head gate has to be pretty quick in order to properly catch the cows. So this leads me to my next point of advice, which is to practice running cattle up into the chute, even if you're not giving any treatments or anything. This will not only help accustom you to the function of the chute, but also help accustom the cattle to the actual process of being run up. And it'll help break some of the negative connotations that come with the chute. Because if you're only herding up the cattle and running them through the chute and catching them when they need to be treated, need to be dewormed, or when someone is sick, then they're going to create these connotations that only bad things happen when they're run up, and they'll be unaccustomed to using it. So if you have time, and I know it can be kind of a difficult task and can seem tedious, but running them up and practicing having the cattle go through, even doing nothing with them, if you just run them up, catch one in the head gate, give a handful of grain in a bucket, and then let them off, that's perfect because it can help create some positive experiences with using the chute, and the cattle will be more likely and it'll be easier to run them up should time come that you do need to run them up. And then it'll help overall just my treatment process. If cattle are accustomed to the chute and they're not uncomfortable, it makes treatments a lot easier. They're less likely to fight and less likely to get injured during the process of treatment. My next piece of equipment that is an absolute must is a cattle halter. These are typically made of rope and are size adjustable, and becoming familiar with the use of the halter is necessary should anything need to be done on or near the cow's head. This can include things such as oral exams, eye exams, any sort of a jugular vein injections, blood draws, etc. So to use the halter, you should start by orienting yourself because a lot of times it can kind of come just in a ball of rope. For example, I have a halter here, and this doesn't really look like much of a halter, but we will make sure that it does look like a halter by the end of this. So the first piece is to orient yourself by finding the fixed piece. And by fixed piece, I mean the piece that doesn't move no matter what you pull on. So we have this long piece here that I will refer to as either the tail or the lead rope. This is usually what you hold. This is not the fixed piece as it can move a lot. So when you're looking for the fixed piece, kind of just pull on everything. So I pull here and this bit moves. So I pull this, okay, so that moves. And then this, my tail moves as well, which we knew. And then if I pull on this piece also moves, which means it is not the fixed piece, which leaves, last but not least, this piece here in the middle. It is fixed, it's tied, that is the fixed piece. And the fixed piece will always go over the nose of the cow right up top here, kind of like so. So the next step is to find the piece that cinches when you pull the tail. So if I pull this long piece here, this piece here gets shorter. So we'll make this a bit bigger here. And if you're having trouble orienting, just kind of pull and make it as big as possible. It has to be big anyways to fit on the cow's head, and it'll be a lot easier for you to orient yourself if it's bigger. So I pull my tail again. I have, starting out, my fixed piece is right here. It's not moving. I pull my long tail, and this loop back here moves. So this is the piece that cinches when I pull the tail. This piece will go under the chin because you want to pull the long tail underneath the chin to tighten that halter, which last but not least leaves this big loop that I made, which will go over the ears, which kind of makes sense. So to put the halter on, you put this big loop and make sure it's big enough. You pull on this end here to make it bigger. Make sure you loop it over both. Make sure that fixed piece is on top. You don't want to cinch the halter with the piece that tightens over the top of the nose. That won't give you effective head control and can cause injury as well. So make sure that you've got that fixed piece on top and you've got that piece that cinches under the chin. So once you have the halter on, you take the tail end. You can either wrap it around a nearby post on the squeeze chute, something secure that's nearby, and you usually want to have the head kind of extended, especially if I'm doing jugular vein draws or giving injections there. So you pull that, you can either loop it around twice and pull it as tight as you can and have someone hold off on that end, or you can have someone loop it and then tie it off with a quick release knot in case we need to pull anything. And if you happen to have nose tongs, those are also a great tool. They can be used by themselves or in tandem with the halter as well. So moving on to the topic of diet, cattle are grazers and if possible should spend all their days out on pasture. Roughage is the most important part of their diet and will keep their health in check more so than any supplements or treatments. The rumen requires digestible fibers for proper function, and thankfully hay in this state is very nutritious and very little supplementation, if any, should be needed. Grain should be kept as a treat, but should not be the staple of the diet by any means, and any grain kept on the property should be stored far away from cattle, ideally behind a locked door. Cattle are very good at getting into things that they shouldn't, especially feed that tastes good. And if cattle are having any issues with selective inappetence, adding some alfalfa can help entice them to eat while still providing a good fiber for the rumen. So now I'll go through just some general signs of health that you as owners can recognize. Cows are herd animals and they tend to stick together and move as a single herd. If you notice a cow is isolating itself or is being left behind by the herd, this can be indicative of disease. Cows usually take between 20 to 30 breaths per minute and mainly breathe through their nostrils. If a cow is breathing with their mouth open and or their respiratory rate is beyond that normal range, that is likely a sign of respiratory distress and a veterinarian should be called to do a proper examination. The eyes and nostrils of cattle should be clear. Redness and discharge from the eye can be indicative of disease. Clear nasal discharge is completely normal from cattle, but any cloudy white or yellow discharge in excess amounts is not normal. Cattle produce a lot of saliva and should be comfortable chewing their cud when you go out to look at them. And the rumen is located on the left side of a cow's body, just in front of the hip bones and behind the last rib. This area is called the paralumbar fossa, and it almost creates a sort of triangle in that region. Rumen contractions are very common, and sometimes you can see them, and if you put your hand in that paralumbar fossa, you can even feel them. And if you see a distended rumen or abdomen or a rumen that is very hard, almost kind of like touching a basketball, a veterinarian should immediately be consulted. Cows will generally lay down up to 12 to 14 hours a day, and if a cow is repeatedly laying down and getting up, refusing to get up, or refusing to lay down, these can all be signs of discomfort or disease, and again, a veterinarian should be called. So, when do I call my veterinarian? I've already touched on a couple instances, but for the ease of the video, I'll just list off some reasons here that I most commonly get called out for. Any signs of abnormal breathing in your cows is a cause for concern, and this can include breathing with their head and neck extended, and oftentimes they'll have their elbows kind of placed out like this, and it really looks like they're struggling to pull in air. Any panting, so open mouth breathing, or repeated coughing as well. Cows getting into grain or chicken feed and appearing bloated are a big time in which you definitely need to consult your veterinarian. Any sign of eye disease, including redness, swelling, squinting, blinking, and or discharge. Any lameness, especially non-weight-bearing lamenesses, a veterinarian should be called. Lacerations on any part of the body And make sure to snap some pictures and send them to me so that I know what to expect when I arrive, because depending on the size, shape, and depth of the laceration, it'll depend on how long the repair process is going to be and how long your management will be of that wound. Any cows that are down and are either unable to rise or unwilling or rise with extreme difficulty with a lot of coaxing, you should call the veterinarian. Calvings usually take between 30 to 60 minutes after the cow drops her water bag, and any signs of major difficulty, or if you see the calf coming out incorrectly, you should definitely consult a veterinarian. So you know the correct position for a calf to come out would be both forelimbs extended with the head following suit. If your cow is simply acting weird or off form by any means, you should probably call your veterinarian. You will know your animals best, and it can be hard to accurately describe or quantify what's happening. For example, for cows, sheep, and goats, it is deeply ingrained in them to act normal. So if they are showing any signs that are abnormal, we will take it far more seriously than they will be willing to show us. And any form of rectal or vaginal prolapses, which often occur on or around calving, you should definitely call your vet out. So these are just a few of the reasons that I get called out, but if you are ever unsure, please feel free to call us at Aggie Vet and Farrier Services. So now that you've called us and we're on the way to take a look at your cattle, here are some things to have prepared to make the examination process more efficient for both patient and for us and for you. So I have the cattle that need to be looked at round up in a small pen that leads up to the chute. It's important for me to assess the cattle before I run them up into the chute because sometimes I like to see how they're walking. I like to see how they're kind of behaving, if they're chewing their cud, if they're restless, etc. So I needed to have a halter ready, and if we need to restrain the head, that'll definitely be useful. So know any and all medications that have recently been given, including how much was given and when. Also know how old the medications are and how or where they have been stored. And make sure, as always, to take lots of pictures and videos if you can, and make sure to pass them along to me so that I can have an idea of what I'm kind of walking into. And have a general idea of how long the condition has been going and how it has improved, if at all, or if it's gotten worse, and what the initial presenting signs were that you were concerned with. All of this information will help me generate the most accurate picture so I can best treat your cattle. Unfortunately, these guys can't talk to us, so I really rely on my owners a lot for helping me through the treatment process. So hopefully this video will help pull together some broad aspects of cattle ownership and care. And as always, like I said before, if you have any questions, please don't hesitate to reach out to Aggie Vet and Farrier Services. We are here to help as best as we can. Thank you so much for watching.